changing your linens. Is it okay if I do that now? Okay. Can I see your wristband, please? Okay, very good. I'm going to pull the curtain for privacy. I'm going to wash my hands and get my supplies, and I'll be right back. Okay? Okay. I'm going to wash my hands. Say that to somebody who cares, please, while you're practicing. Again, I usually take the towel last because that's my barrier. So hold it out away from yourself. This is your barrier. So I usually take that last. And it's not like I'm like, you know, can juggle. If you feel like you're going to drop something, you can always rest it on the bed. Okay? This is just a barrier. Okay. Chiquita, this is a bath blanket. I'm going to put it on you for privacy. Okay? While I make the bed, is it okay if I put it on now? Okay, good. I'm also going to put your bed up so I don't have to bend over so far, okay? All right, I'm going to ask you to hold this. Now, when you're making a bed, you can put this this sheet on all the way. Just right straight down because you're going to pull that top sheet out from underneath that. Okay? How are you today? How was your lunch? What did you have?
I had salad.
Salad? Good. Very healthy for you. Good. There you go. Alrighty, I'm gonna ask you to hold on to that that bath blanket while I open it up. No shaking of the linen, please, because if there's any bacteria, it's gonna fly up into the air. Okay, so she's providing privacy for herself. I'm gonna take this top sheet out from the bottom, and I'm going to just pull it out, asking her to, and gently, not too fast. You don't want to cause shearing, you know, I'll explain what that is later. Okay? Keeping that away from your uniform. Can I have the laundry basket? We have one laundry basket, so I'm going to just put it in the center while you guys are practicing. And no three-pointers, okay? So just place it in, no throwing the laundry, the dirty soiled linen. Okay, now I'm going to ask her, I'm going to ask her to bend her knees and move her hips over toward me a bit and roll on her side. A safety concern with this particular skill is that somebody's too close to the edge. Okay? Because we changed her position, we're going to ask her to lift her head. I'm going to ask her to place her head down. So we give her the pillow for comfort. Okay, can you straighten your legs? And just bring your hips a little to the center. Bring them to the center. And then your arm over. Good. Okay. You're going to, I need you all to come. Never mind. I'll show you at a later time. I'm going to roll, watch the way I roll this sheet. I'm going to roll it toward her. Okay? So it's going, I'm rolling it toward her. I'm not going to tuck it underneath her just yet because I have another sheet that I have to tuck underneath it. And I will call you over when I do that. Okay, bottom sheet. I checked it when I went to get my supplies. That it has the fitted sheet, the elastic. Okay, we're going to open this up. Okay. Place it on the top.
4138? 3138. Yeah, it's in your picture.
Again on the bottom.
I'm not doing senior pictures.
Okay, I'm going to ask you to all.
I'm in scrub.
I'm going to ask you to come on over this way so you can see how I put this bottom sheet down. This might be the more difficult part of the skill. Now when I roll this up, I'm rolling it toward me. Okay. I will acknowledge that I'm going to try to keep the creases out of the linen. This one has a side rail, so it's a little more difficult. Okay. But I rolled it toward me. The center of the body is the heaviest always. So I'm going to tell her that she's going to feel me adjusting the sheet. I'm going to lift this sheet up just a bit, okay? And with an open hand, I'm going to try to unroll this sheet. I'm actually unrolling. I'm not pushing. I'm unrolling it. And she's going to feel me doing that. I'm going to let her know she's going to feel me. And then I'm going to roll it back toward her. Okay? I do the same with her shoulder. I'm gonna lift your shoulder a little bit, and I'm gonna unroll that sheet under that arm. You can feel me, can't you? Okay? And then I'm gonna roll the old sheet back toward her. Same thing with the feet. I can lift them. I'm gonna unroll this as best that I can. We don't want any skin touching the plastic. Okay. And now that we have that, see how close she is? I don't know if you can see this, but it's really underneath her. The linens are pretty tight. I'm going to have you come on your back, hold this up when you ask them to come on their back, or they'll get stuck in that bath blanket, okay? Okay, and just lift your hips to the center a little bit. Good, and rest down. Okay. Now I'm going to go on to the other side. And the same thing. No, not for this if it's not soiled. We're assuming it's not soiled, okay? Standard precautions would be if it was soiled with blood or body fluids, we would use gloves. Can you lift your head? Because now I moved her, I need to fix her head. Okay, and I'm going to ask you to bend your knees again, move your hips slightly toward me, and then roll on your side all the way. Okay, now come on around this side so you can actually see what we have here beside her hair. Okay, so what do I have here? I'm going to take off from the top to the bottom, not from the bottom up. I'm going to take off from the top to the bottom, and while I pull this out, I'm going to try to get the other one out a little bit, okay? Okay, lift your hips a little bit. Good. Holding the linen away from you so that it's not really close to you, okay? And I'm going to put this in the laundry basket. Okay, and then we're going to put our sheet on, and I'm going to acknowledge that I'm going to try to get all of the wrinkles out. Okay. All right. Okay, can you rest on your back and move your hips to the center of the bed more? That will be the safety issue, will be the person's position in the bed. Okay? Now, this is a top sheet. I'm going to put this top sheet on you now. If it's folded correctly, we can see that folded this way. Okay? I want you to acknowledge the seam. Did you remember that from last year? Acknowledge the seams. Okay, the soft side will be touching her, so I know. Okay, actually, and it has to go the other way. And we can do what we need to do, but just not shake the linen. Okay? Okay, the reason I do this is because it's going to go right up to her. Okay, and when I unfold this, all I have to do is, like a fan, I fold it this way, and then I fold it this way. And that would be dead center for her. Okay, that can be folded on right there. What I can do right away is I can give her a little fold over. Okay, we want to make sure that we have an even amount on both sides before we proceed. We just want to make sure that, and you can come around to the other side and fix it. Okay, you see how the line is in the center and the creases are here? Can you hold on to the top one for me? I'm going to pull out this bath blanket. Again, not like you pull, not like the tablecloth. Pull out where you're pulling it real fast. Just nice and smooth. Okay, awesome. This will go over the edge of the bed, and now we're going to do our corners. This is a mitered corner. Okay, I'm bend at the knees for good body mechanics. I'm going to lift up the mattress about 12 inches from the bottom, or maybe a little bit more, as high as I can. I'm going to use this as my center, and I'm going to tuck as much as I can, pulling it a little bit. Bring it down. I want you guys to come on over to this side. This is loose. I want it to be loose. I bring this toward me, straight up, and then I rest it down. And wherever there's a little bit of a buckle there, or I smooth it out, okay, I can hold this and come on down, and that's what a mitered corner is, okay? I'm going to come on the other side and do the same. Lift up, give a nice tuck so it's smooth. Okay, do you feel that pushing your toes down, Shaquille, a little bit? Okay, I'll show you what we need to do. You're going to come over towards me, straight up, You can use your hand if you want to, right at that corner, and place it down, and then tuck that under, and here. And the last thing we do is a toe pleat. We just take it and we pull it up a little bit. If she was not able to move herself, that force of pushing the sheet down can make her feet go down, and it can, when you don't move, you get atrophy of the muscles, and that can cause foot drop. Okay, so we do that toe pleat, okay, to avoid foot drop. Okay, now last but not least, we're going to use a pillowcase, and we ask her to lift her head, showing that we would support it if she needed it. Hold this away from our body. You know, at home we hug our pillows, don't, you know, to take them, and we shake them, hug them, just to put the pillowcase on and off. If this had a tag, we would have that tag toward us, because the tag side has to go in first. Okay, the way we put a pillowcase on without shaking it is we just, like a sock. You roll it up like a sock, and you take your thumbs in the very corner, you know, all the way up to the corner, okay? And I have my thumbs here. You turn it inside out, you grab it, and then just get that top on, and then you can grab this and pull that down. Yeah, I shake them at home. We can shake them at home, but in a healthcare setting, we wouldn't shake them because of what. Okay, now, if that is considered the door, the entrance to the room, I would put the closed side towards the entrance of, can you lift your head up? How's that? You comfortable? Okay, very good. And that is it. Is there anything I can get you? You want the television on or a magazine? Okay, well, are you comfortable? Okay, good. I'm going to, I'll give you the call bell. Here's the call bell. Call me if you need anything, okay? I'm going to open the curtain. I'd like you to keep, whenever you have a barrier like this, I'd like you to keep it on to the very end and actually use it so that you can push it back to where it was. Okay, so if your hands were contaminated, they wouldn't touch the table, they would touch the towel. Okay, I would put this in the laundry basket. I'm going to wash my hands. I'm going to come back and look at my care plan. And she looks comfortable. I offer the bell, the curtain's pulled. I'm happy with what I did, and I'm done.